Hi, I'm Dr. Michael Ford. I'm an endodontist here in Central Texas. We're in Harker Heights. We're about an hour north of Austin by way of reference, as in deep in the heart of Texas. I'm here to talk to you today again about the gentle wave machine. This is the machine itself. This is the action part of it, the little handpiece that works. But let's talk about what it does and the difference that it makes in root canals. All root canals are not created equally. Each root canal is a unique, handcrafted procedure that is unique to your tooth and to what's going on with you. So a root canal is not a root canal is not a root canal is what I like to say. That's kind of confusing. It's not like buying a Ford truck here in Harker Heights or across the way in Temple. You're not buying the same thing. Each tooth, again, is different. This procedure makes a huge difference in the way that we're able to do root canals here in our practice. Let's take a look at a case. This is one of the early cases that we did that was a real eye-opener for me, something that we had not seen before. And we'll talk about that in publication and scientific articles. This young lady presented to us with a fractured tooth. You can see there's no restorations in this tooth, so there's no deep fillings or repeated fillings. Trauma, deep decay that all caused the pulp to die. This was simply a crack in the tooth. It had flexed apart enough to make the inside of the tooth sick, giving her a lot of symptoms. So we opened it. First we always do a CBCT or three-dimensional X-ray of the tooth. This is what that looks like, and you can see that this looks slightly different from the two-dimensional X-ray, but very, very similar. We also can now look at the tooth sideways. Now, sideways is an X-ray that we can never take. This is strictly from the CT, or in dental terms, it's a CBCT, but it's think of it like a computer tomography. And here it is also a little slice from the top part of the tooth, looking down just below the crown level. So you can see the front root here, you can see the back root here. Notice here between these two canals, there is what's called an isthmus, or a little dark area in here where we can see there's something in there, but what is it? Well, here's our case after we finished it. So we opened it up, did the gentle wave procedure, obturated or filled the tooth. Already in this, though, you can see, look, there's an extra little canal right down here. There's a couple little extra canals right over here, but let's take a look now at what we call the shifted view. Now, the shifted view turns the X-ray sensor in your mouth so we can see there are two separate canals in the front. That matches up here with the CBCT. Now, this is one broad canal in the back, and you can see that also. Now, here what we're picking up, look at this. There's that little side canal that was down there. But more so, check out all of this. Wow, that is a lot of tissue that would have been left inside this tooth with a conventional root canal. Conventional root canal, this picture would have looked one line. All this would have still been left inside the tooth. See what that looks like on the CBCT. So here we are looking at it from the top. Again, this is that front root. There's the one little canal. There's the other, but look at all this stuff in between. The back canal you can see is a broad oval. Also very difficult to clean thoroughly. Here we are again from that side view of the tooth. Nothing so remarkable there, but let's look at that. Let's look at that front to back view of the tooth. Look at this. This is that front root. So this is the outside. There's her cheeks out here. This is the inside, so tongue is in here. And look at all of this that the gentle wave cleaned out. All of that area where the tissue was that would have been left by a conventional root canal. All right, so that's great there. Here we are a year later. Now we have a crown on the tooth. So tooth's doing well. Crown looks great. Good job by the general dentist. And again, our shifted view here, we can see, look at all that stuff. Of course, all that is still remaining in there because that's now a permanent part of the tooth. And here we are then, just in this year, April of 2020. So here we are at a little over a 2-year follow-up on this particular case. Of course, she's doing well, and this tooth is very, very comfortable for her. Very exciting in this regard because that would have been a lot of tissue left inside the tooth. So 3-4 years down the road, with a conventional root canal, we would have started seeing a dark area forming down here at the bottom, indicating a reinfection. So the gentle wave, tremendous thing. If you want to read more about it, you can go to my website at drmikeford.com. Also, if you want to see just specifically more so about just the gentle wave itself, you can check us out at rootcanalstexas.com. That's rootcanalstexas, Texas.com. You can call our office at 254-554-3636. Thanks so much.